My name is Erin Wilt. This is discussion number 2 for psychotic disorders. This patient's a 22-year-old. Parents are presenting with him, reporting that they have an 8-week history of social withdrawal, functional and academic decline, self-neglect, and his parents report that he's responding to internal stimuli. So when we're looking at that, the 5 questions that I would, as a provider, find the most appropriate or most important would be to gather some information to inquire deeper into those symptoms that parents are reporting with the collateral information. So the first question that I would ask would be, just sometimes people that are under a lot of stress may hear sounds or voices that other people around them don't hear. Has that happened to you? And if they endorse that, I would go a step further to ask, what are they hearing? What do the voices say? And with that, we're not only confirming the auditory hallucinations, but we're also confirming whether or not those hallucinations are command. So we're assessing for a safety risk as well. I would ask, the second question would be, you had mentioned feeling that people may be watching you or talking about you. Can you tell me more about this? How are you certain that is occurring? Is there maybe another explanation for that? And with that, we're not only looking for paranoia, but we're looking at referential thinking as well. The third would be, over the past 2 months, how has your motivation been? How's your energy level been, or your interests? Have they changed? Was there something that you used to enjoy doing that you no longer enjoy doing? And this is going to be looking for the endorsement of negative symptoms. Do we have this patient that's presenting with anhedonia, with social withdrawal, with self-neglect? Fourth question would be, compared to 6 months or a year ago, how do you feel like you're doing with responsibilities, school or work? How are your friendships or familial relationships going? Do you feel like you're able to take care of yourself every day? Are you up? Are you getting a shower? Are you getting dressed, changing your clothes, brushing your teeth? And we're going to be looking here for the marked decline in functional ability. The fifth question, I would ask, when did you start feeling this way? And then I would go a step further with that and inquire, have you used any drugs or alcohol, any illicit substances, stimulants, cocaine, opioids, even medical marijuana or recreational marijuana? I would also inquire on any medical potential source. We're looking at any, recent fevers or bacterial or viral infections. We're looking at any head injuries, whether those be recent or history of. We were looking at seizure disorders or any other medical problems that the patient may have. What we're doing with this is, again, ruling out any substance-induced cause, also a medical cause, and then we're establishing the onset and the duration. So for the screen with this, I'd be looking at the PANS. We're looking at the positive and negative symptoms, also the general severity, and then we have the ability to hit the baseline and then track those and trend as well. Baseline lab workup, also urine drug screen would be appropriate, looking at CBC, CMP, TSH, vitamins. We'd be looking at, folate, B12, vitamin D. Again, we could look at the tox screen. We could also go so far as to look at SED rates, CRP, ANA, looking at any of those as well. For the 3 differential diagnoses that I have, because we don't hit the 6-month mark to capture schizophrenia, I have the schizophreniform. Because again, we aren't hitting the 6 months, we're only at the 2 months or 8 weeks. And that's going to be my working or my leading diagnosis. The second, I have substance or medication-induced psychotic disorder. Again, I don't know whether or not this patient endorses the use of any cannabis or stimulants or illicit drug use. However, with the tox screen, we can rule that out, but I have this as a differential diagnosis. Mood disorder with psychotic features, and we could look at bipolar or major depressive with psychotic features, schizoaffective, and that would be a differential for me as well. For treatments, I'm looking at non-pharm CBT with psychosis specialty or focus, and then pharmacologic would be looking at a second-gen antipsychotic. I would elect for aripiprazole, Abilify, just because of the side effect profile. With this, we're going to be diligent in monitoring metabolic effects. So collaborative care is going to be important. We can make referrals out for any other specialists. You know, if we see that we have some medical underlying issues, of course, making those referrals out. Contact with PCP for any medical conditions that are being managed currently, for any recent labs or relaying any labs or any concerns that we have obtained as well. Maybe looking at social work or case management to assist with, job coaching or assistance with school and education. So when we're looking, though, in the comparison for early onset schizophrenia, this patient does not hit that. We're looking at an age of 13 to 17 in the EOS. This patient's 22. And with that, we're looking at more prominent negative symptoms. We have cognitive impairment. We have developmental delays, social delays, motor delays, language. May even have a neurodevelopmental disorder like an intellectual disability or autism spectrum disorder, communication disorders, and looking in the differentiation between the adult onset window, which our patient would fall into, and EOS or early onset schizophrenia.